Dear colleagues and friends, today, the Food and Agriculture Organization of the United Nations, the UN Environment Programme, the World Health Organization, and the World Organization for Animal Health are proud to launch the One Health Joint Plan of Action to integrate and coordinate our work across the human, animal, agricultural, and environmental sectors. We have one planet and one health, and together are working for a safer, healthier, fairer world for all. I thank you.
This action plan requires cross-disciplinary thinking and preventive action in order to strengthen the health system, preventing antimicrobial resistance and ensure global food safety. It is very important to me that this plan is very, very concrete, and in fact it is already very specific by defining clear action fields and goals. We all know that prevention is better than having to deal with problems that we could have avoided in the first place.
In this globalized world, investment in this interdisciplinary response to emerging infectious diseases that originates from animals will significantly reduce the impact of zoonotic diseases and prepare for future pandemics.
In our own work, we, as International Alliance Against Health Risks in Wildlife Trade, we see ourselves at the very heart of One Health, actively working against key drivers of both biodiversity loss and future pandemics. And we actually attempt to minimize the health risks from dealing and trading with wildlife commercially. And by identifying effective interventions, unique, innovative interventions, and convening perspectives and practical knowledge from diverse disciplines.
The urgency of action is what's kept me awake and thinking that we don't have time to waste, and now we have to invest in prevention, and we have to reverse the loss, the biodiversity loss, and many of the drivers that brought us here to this situation where we have pandemics and climate change and all these disaster that's happening to us. So time is now for action and urgency.
The definition that the One Health high-level expert panel provided is One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at various levels of society to work together to foster well-being and tackle threats to health and ecosystems, addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development.
What is that we want out of this map that you see here? A world better able to prevent, predict, detect, and respond to health threats and improve the health of humans, animals, plants, the environment, while contributing to sustainable development. That is the big game. That is the impact that we want to create. So how do we want to do that? So I'll speak about the 6 action tracks. So the first one is, how do we enhance One Health's capacity to strengthen health systems? This particularly involves strengthening One Health capacity through guidance, methodology, and tools. And then the last one is on integrating the environmental dimension into One Health. We're like the neglected kids up to now. But we were not actually neglected. Everything that is talked about, whether AMR, food safety, zoonosis, it is just in the heart of the environment. So, but it's good that now officially it is part of it.
Yeah, and I'd like to address the question that came online about what are the strategies in key areas. Well, I think, as I said, we need to be in a listening mode. So I don't think we can say that up front, but certainly there are some common elements that emerge as common needs. I mean, one of them is having surveillance systems which are efficient and which are supported by adequate capacity. Laboratory diagnostic capacity is a big problem for low and middle income countries, so we need to address that, for example. But we need to have a good capacity also of analyzing the risk, and then we need to have adequate human and animal health workers' capacity. So I think the surveillance and the capacity building are clearly two important areas.
In the joint plan of action of the Quadripartite, there is a significant part of OLEP expertise included as well. We are lobbying for One Health in these different areas, and we are currently working on a theory of change of OLEP, which will supplement and expand, but will be aligned with the theory of change of the joint plan of action. And we are also working on a paper on One Health surveillance. So, I mean, what does it actually mean to implement One Health surveillance issues? What do we have to keep in mind? This is dear to my heart also at night. I think we have to implant the concept of One Health, not only One Health in all policies, but One Health in all minds. And my feeling is One Health is actually not a concept. One Health is a way of living.
In terms of prevention, just like the medical team loves to talk about primary health care, one of the things we really need to look at is how can we also do prevention at source. We need primary prevention at source. And I think that is really important, in particular in the context of climate change, biodiversity loss, and pollution, which has a significant impact on the topic that we are discussing here.
Ladies and gentlemen, One Health is a defining topic of our time, and it is good that you had an in-depth exchange today. Not least because every event that is held raises awareness for the subject. However, for One Health to become, as you once put it, Mr. Mettenleiter, a way to life, there is still a lot of work to do in this context, with regard to consumers, veterinarians and doctors, but also with regard to practitioners such as, for instance, farmers. But after today's event, I'm confident that we will be successful in further implementing the One Health Joint Plan to action. Thank you all. Good luck.